Hiya and kia ora. My name is Heidi Baldwin, and along with Megan Anakin, we're delighted to warmly welcome you to today's session. As we begin, on behalf of AIPPIEN and ANZAPPIE, I acknowledge and pay respect to the traditional owners, custodians, and knowledge holders of the lands and waters across Australia on which our members live and work, and to their elders past, present, and future. AIPPIEN and ANZAPPIE acknowledge Māori as tangata whenua and Te Tiriti o Waitangi partners in Aotearoa and New Zealand. I invite you to introduce yourself and make any acknowledgements you feel are appropriate using the chat function of Zoom. Please ensure your first and last name are visible on your video tile. If two people are joining from one device, please list both names. If you're an AIPPIEN member, please add IPE after your name, or if you're an ANZAPPIE member, please add ANZ after your name. This will help us to assign a good mix of people to the breakout rooms. This event is being recorded. Please turn off your video if you prefer. However, we encourage you to turn it on during breakout rooms, which will not be recorded. Please feel free to use the chat to share comments and questions throughout today's session. These networking events aim to spark conversations among those interested in IPE, encouraging the exchange of ideas and practices. We invite you to draw on your own experiences to foster meaningful connections and share insights. This is a great chance to connect with colleagues in a discussion-based session introduced by our guest presenter, Professor Margo Brewer. Today's session is entitled Embedding Interprofessional Education in Clinical Contexts. We will hear about examples of interprofessional education in a range of clinical contexts that have been sustained over time. Participants will have the opportunity to share their own clinically based IPE and explore how the international examples might be adapted to their own health profession education. Let me share a little bit about our presenter. Professor Margo Brewer is a speech pathologist with a national and international reputation, with extensive experience designing, leading, and guiding IPE initiatives. Margo's work in this field has been recognised through 11 teaching awards, 2 teaching fellowships, and more than $2 million in competitive teaching and learning grants. She has published 45 peer-reviewed journal papers and book chapters, and authored several widely used IPE guides. Margo holds senior academic positions at Curtin University, Australia, and is chair of AIPPIEN's Steering Committee, where she continues to lead and influence the development of interprofessional education across health professional programs. We anticipate that you will leave with at least one new idea to explore and widen your network of colleagues with interest in interprofessional education. Over to you, Margo.
Thanks very much for that introduction, Heidi. And so why I've chosen to talk about interprofessional education in clinical contexts is because to me there's a sea of interprofessional education opportunities out there, and it can be a little bit overwhelming. So I'm going to take that down to this nice little lagoon and think just in a smaller area about interprofessional education in clinical contexts, which I think is probably one of the most important environments in which we can deliver interprofessional education. It's where there's a very high degree of authenticity because students are working alongside clinicians, working with clients, patients, service users, and they can really see directly the links between what they're learning and doing to their future practice. So, and Megan's driving the slides, so I'm going to say next slide every now and again. So just to, what we're going to do in this networking session is literally dip our oar into this lagoon. So I'm just going to talk for a short period of time and give you some ideas that you're going to share in a rich group discussion about what might be possible in your context or what you might already be doing in the clinical space. See, I like a framework because, as said, there's a whole lot of ideas out there, but a framework helps me think about a structural way of planning interprofessional education. So I'm going to share a 3-tier framework, some examples at each tier, and that will inform or help guide your group discussion. Then we'll get you to share some of the ideas from your groups and provide a final wrap up. So as you can see on the next slide, I've adapted this three-tiered framework, or three-tied framework even, from a book chapter I published with Emeritus Professor Hugh Barr right back in 2012 in the book that you can see here. And on the right, you can see the three-tiered. So the idea is that there is interprofessional education that you can add within a clinical placement or rotation. There are examples that you can embed so that they are fully embedded within a placement, or if you've got a lot more resources, time and energy, you can do a dedicated interprofessional education placements. So let's have a look at some examples of the added model. So the added model is the idea where you've got a whole lot of students on placement in a particular facility and you're looking for an opportunity to provide interprofessional education experiences, for example, on a Friday lunchtime or a Friday afternoon. On the left, there are images of two games. The first, the IPEG, is an interprofessional education game developed by colleagues at Robert Gordon University in Scotland. And it's based on a game of Monopoly. There are task and discussion cards. The task cards look at the roles of the different professions, and the discussion cards are about case scenarios, client case scenarios. The students work their way around the Monopoly game, and through this they explore particularly stereotypes around different professions' roles, but also unpack how they might care for people with different clinical scenarios. A more recent game is Friday Night at the ER. Now, this is a complex systems thinking game. It's based on 24 hours in the ER, and the players have to collaborate together to solve complex problems using data. And it allows them through that collaboration to understand the different roles of the people working in the ER context. And the other thing I really like about it is that added layer of systems thinking, which I don't know for anybody who read the chapter that Megan and some others have published about the future of interprofessional education in ANZAPPIE's journal. But one of the things we talked about is to prepare graduates for the future, we need to start embedding systems thinking into our interprofessional education. So you could have a game that the students play. Another opportunity is to have something like a case-based seminar or workshop, for example, during a lunchtime. But for me, lots of our students get to do that in the university. So I was trying to think examples here that you might not have already embedded at university. So I think a debate is a really good idea. And you can see co-pilots generated some very stereotypical images of health professionals having a debate. So apologise for Gen AI's stereotypes. But you might be able to pick, I'd encourage you to pick a topic that would be of interest to an array of professions that really lends itself to a rich debate. And we've had debates like this within the ANZAPPIE conference, which have been really useful as well. And I was thinking about sustainability in healthcare would be a great one. But you want to pick topics where there are opportunities to explore the roles of different professions. So the participants who are in the debating team and in the audience get to learn about, from, and with other professions. Another idea is to take the notion of a healthcare team challenge. And I'm not going to do this initiative any justice, but you can find information on the internet about this. And they've been going since they were developed at the University of British Columbia decades ago. The idea is you would have students on placement in the clinical facility organised into interprofessional teams, maybe a week or two before the challenge event. Each team's given the same clinical scenario, a client with quite complex needs, so they really need to collaborate together to be able to address those needs. And the students in front of a live audience and judging panel present their integrated plan for how they would work together to provide excellent care for that client. And yes, they're judged by the panel. And they're our students, when we've done them before and when I've seen them happen nationally and internationally, they're really great fun because the students do love the team challenge. So they're pitching against each other. So they could present their plan in any way they like. They could talk through it. They can act it out. They can role play a discharge meeting or a home visit. They've got lots of creativity in how they do that challenge. So that's the added model, where you take a game, a debate, a challenge, and add that on within our clinical placement or rotation. The next level of the model is more where something's embedded in the way things are done. For example, you might require all medical students or physiotherapy, speech pathology, whatever students they are, who go out on placement to shadow at least 2 or 3 other professions. The students, another generative AI stereotypical picture here, the medical students observing the physiotherapist working with a client. So this is more of a student-driven interprofessional education experience. So the students have got to find opportunities to shadow either students or staff from other professions. They look at and analyse how they assess and treat patients or clients. And they think about, what does that mean? How do they work with clients in a different way? What information and areas do they focus on? What can I do with that learning in my future practice? So it does require some opportunity for the students to debrief and reflect on that learning for it to be really rich. Another thing that we've done in one of the women's hospitals is had what we call red flag cases. So all the women who were referred into the hospital, in this case, who had obesity and pelvic floor issues, those referrals were set aside, and the students on placement at the time from dietetics, physiotherapy, nursing and/or medicine worked together as an interprofessional team to assess and provide care for those particular group of cohort. And so you can have anything. You can have red flags around any other case scenarios. So that's a way of embedding shadowing or red flag cases into a particular clinical context. The last one is where you've got a dedicated placement. And these on the next slide, thanks Megan, are where students are actually allocated to a site together. The image on the left is our student training ward that we set up in a general medical ward in a teaching hospital. So students from medicine, nursing, pharmacy, physiotherapy and occupational therapy ran a section of the ward, obviously under supervision of staff. And these training wards have been going on in Europe for decades. It's a really fantastic model where the students are working together running a ward for about a 2-week, sometimes 3-week rotation. And we took that model, as you can see in the middle image, into a rehabilitation and aged care facility, where you can see here a student from occupational therapy and speech pathology working with one of the residents around activities of daily living. But there's a whole team of students on placement in these facilities at any one time, working together, learning together, working with the residents together to provide services. And we also wanted to look at how can we replicate that out in the community. On the right, you can see physiotherapy, occupational therapy, and speech pathology students working in a primary school in metropolitan Perth, a school located in an area with really complex social issues and healthcare needs, where the children don't get to access services because their families are facing such complex issues. So the students are located in the school as an interprofessional team, working with the teachers and others in the school to provide health and social care. So that's like the student training ward model, adapted in different contexts. And on the last slide, Another example, which is much shorter, but again has been sustained since 1995, is the Leicester model, and you'll find published papers about this. So the Leicester model is about quality improvement and about understanding health in the community. So here, students are organised into small interprofessional teams, and they're allocated a patient who's working with a local health service. The students go out to visit the person in their home and interview them about their health journey. So they get to understand what it's like to live with the condition or conditions they've got, understand the social determinants of health, and also work with the patient to understand how could they have a better journey through health? How could their health experience be improved? And through that interviewing process, the students get to understand each other's roles, their scope of practice, what they focus on when they're thinking about healthcare. Then the student team come back together and think about how can they influence the healthcare system. And they present back to the health service providers their suggestions for how to improve healthcare for each of those patients. So it's got this lovely quality improvement built into that. And the students report not only learning a lot about each other's professions, but how they can be influential agents of change in healthcare. So that's my flying dip across a model of interprofessional education across 3 different tiers. So for those of you who have been in one of these networking events before, the richness of these is now spending time in your groups exploring some of those ideas. So what I encourage you to do is, if you've already got an interprofessional education experience embedded in a clinical context, talk briefly about that. Share, just share it, as I said, very briefly, so everybody gets a chance to talk. And if you don't have something to share with your group, perhaps select one of the examples that you've heard of that I've drawn across the international interprofessional education field, and think about what might be possible for students, or you might be working in a health service where you would like to embed interprofessional education for staff, because all of those examples apply for pre-qualifying, post-qualifying students, but also for staff in facilities. So that's what you're going to get to do now. I think Heidi's going to give you some specific instructions, but that's in essence the task I'd like you to do. And if you whiz through all that because you've got an amazing, well-advanced interprofessional education in clinical context, I encourage you to think about the last bit, if time permits, is what might be needed to ensure the idea you've got, whether it's real or imagined, is sustained. Because embedding interprofessional education in clinical context, as I said, is a bit more resource intensive than it can be in the university environment. So you want to plan for sustainability from the outset. But over to you, Heidi, to talk a bit more about the breakout groups.
Thank you, Margo. That was really inspiring, and I'm sure that we'll see that reflected in our breakout rooms. So just a reminder that we won't be recording in the breakout rooms, so please do turn your video cameras on so that you can see each other. In a moment, you'll be invited to join the breakout room to discuss these questions, which are in the chat. You've got several tasks actually. We've got a lot of interest in today's event, so we're going to ask you to nominate your facilitator when you get to your room, and I suggest that that might be someone who represents AIPPIEN on the steering committee, or someone who is a fellow or associate fellow in the ANZIPPE. And then the second task you will have is to nominate someone who can be a scribe, so someone that either opens a Word document and captures the essence of the conversation on the Word document or into the chat. I'll just remind you, while you're in the breakout room, if you copy your conversation from your breakout room into the chat, make sure you post it before you get called back to the main room, and that way you'll be able to copy and paste it. So when you join the room, once you've nominated a facilitator and a scribe, Please briefly introduce yourselves to each other by saying your name so that everyone can pronounce it correctly, where you work and your interest or experience with IPE before discussing these questions. We hope that 20 minutes will be enough. We know that it's always a bit of a race, but very exciting to have that time to start those conversations. And then we will return to the main group where we'll ask you to put your comments about what you discussed, your insights from your exploration of the questions, and then we'll have a wrap up with Margo guiding this along with the facilitators from each of the rooms. Okay, so about to go into the breakout rooms. So thank you for the rich discussion. It wasn't nearly long enough for the amazing concepts that we were throwing around in our room, but it was wonderful to meet so many other members with different experiences and perspectives. So I'm going to pass over to, well, firstly, I'll ask our scribes from each of the rooms to drop your comments about an insight that occurred, and thank you with one group already, group 8, about some of the discussion that happened in the room. And Margo will lead some of the discussion, probably starting with something that may have been discussed in her group, and then pick up on things that happened in other groups. I see many of our members from AIPPIEN who may also want to share some of the insights that came from their rooms. So I'll pass over to you, Margo. Lovely to see so many familiar faces here as well.
Yeah, absolutely. And yes, it was a very rich discussion in our group, and there are so many ideas coming forward. It's hard for me to read them and have a conversation with you at the same time. But yeah, certainly in my group, and it looks like that from the contributions people have had, there was quite a diverse range of experience from I'm fairly early on in thinking about this to, you know, we've got some wonderful, rich experiences happening. And like for many, the rural setting is often a place where I think the health professionals naturally have built good relationships with each other, tend to work very collaboratively together. So often quite advanced in the interprofessional education space, providing that. And that was true certainly in my group. But there was, what I thought was really interesting to hear was the number of facilities that have got a dedicated educator role. And that reminds me, I don't know if you're familiar with how advanced the University of Toronto is in this space. And if you aren't, you can go onto their website. They've got a whole centre, like most universities in Canada, they've got a whole centre dedicated to interprofessional education. It's called collaborative care there. And they've got whole guides about facilitating interprofessional learning in clinical contexts. But one of the best things that they have got in place in the hospitals in Toronto is an interprofessional education lead who's got dedicated time and expertise in embedding interprofessional education for staff and for students. And I think that came across in my group, and I don't know if that's the experience in other groups, but you need some leadership of this for it to work well and to be sustained over time. The other thing I think is important is, and we know this from the literature, is preparing staff for the facilitator role is also really crucial because it's different from teaching. It's different from that direct teaching that we can do so well when we're experts in an area. Facilitation's much more of a hands-off, sitting back, getting the students to be sharing their learning together. There is a evidence-based, a little infographic, one-pager that the AIPPIEN group developed with some input from the infographics team at Monash University that's on the AIPPIEN website. So if you want to download that at all, you can get that via searching for AIPPIEN, but it's on the ANZAPPIE website. I can see there's some ideas. Some people talked about the add-in model. And I can see some saying about less involvement of some disciplines. One of the things we were talking about is in our group as well is the allied health professions are often used to working and setting up interprofessional education together, but medicine and nursing aren't always as integrated as they could be into that. And I was saying I wouldn't see that as that's an opportunity rather than a barrier. Because I often encourage people when they're thinking about interprofessional education in the university or clinically to start a bit small, like don't start on too big a scale, or it's really hard to get the staff together and to design something that's truly authentic for the learners. That said, though, when you're wanting to include other professions or disciplines, you need to include them in the design. So you need to go through a redesign phase. It's much harder for people. It's much harder to deliver a really authentic, high quality experience if it's been designed by other professions and has not included that. So I would recommend if you do start small and then you think, let's expand this, that you go back into the design phase and redesign it with input from people from the other professions who are going to be included. So think about that facilitator training. Make sure the design includes everyone who's going to be involved. And think about sustainability from the outset, because you really want to get the investment for the time and energy. And one of the things about sustainability is evaluation. So everything, like we're all the resources are precious now. They're precious in health and social care. They're precious in the university, and people want to know that it's making a difference. So it's really important, again, to wrap an evaluation framework around what you're doing to ensure that you've got evidence that that you're having an impact. What you're doing is having an impact on the learners. And I would also capture it. Early on, I thought about focusing only on the students, but now I think about program evaluation much more broadly. And what's the impact for the staff involved? How has their involvement changed the way they think, the way they practice? And if you can do something lovely like the Leicester model, where it's about the patients and it's about quality improvement, how can you have an interprofessional education experience that's not too resource intensive, but actually leads to improvements in healthcare? Because that would be a very powerful driver for the health service providers, and a great collaboration between a university and a health service. So there's some of my initial thoughts, Heidi, and then I'm going to hand back to you because the time always whizzes by. We all want more time. This is a taster, as I said, dipping our oar into the water. But there's lots of good resources out there that people can explore, and obviously happy for people to contact me and other members of AIPPIEN and ANZAPPIE who are really advanced in this thinking as well.
Wonderful. Thank you so much, Margo. And I think the fact that time whizzes by is testament to how valuable it is even to create this quite rapid fire connection with other people. You can see there's been very rich discussion from just having a quick skim of the chat. So thank you everyone for joining us. Thank you, Margo, for this incredibly compelling session that you've been guiding us through. I also want to thank our AIPPIEN and our ANZAPPIE facilitators and our scribes that were present. That was a lovely segue, Margo. So if you have a look in the chat, I've actually put in an evaluation survey for today's event. We do value your feedback. It guides what we do, which is to encourage conversations between people interested in IPE, to exchange ideas and share practice. And we want to know if we hit the mark or not, and what we can do to improve your experience next time. In a moment, you'll also see that we've got some advertising for other things that are happening. So our big ticket item is an ANZAPPIE conference happening in Christchurch in June, July of this year. So we would encourage you to attend and meet maybe some of the people that you've met here today. There's always an interprofessional event run by AIPPIEN that you're very, very welcome to join us at. and that's also a very lovely way to connect. We also have some professional development events run by ANZIPPE, one on the 19th of March about evaluating teaching practice. And there's also going to be one, someone's having some trouble with the survey. We'll also send the survey out to you if there's an issue with it, if anyone's trying to do it now and it's not working. In April, AIPPIEN will be presenting an interprofessional education activity for ANZIPPE, and so we will use the feedback that we collect today to inform the steering committee about what our members and what our interesting people want to hear about. So encourage you to fill out the survey, and if it's not working at the moment, you'll get one emailed afterwards. And there's upcoming events for AIPPIEN networking, one on the 3rd of June that we welcome you to come to, about student interprofessional patient advocacy, so a pilot that was conducted between nursing and medical students. So it hits on some of the discussion that was brought up today about how it can be quite difficult to get these things off the ground, start small and build momentum. So we'll be looking forward to hearing about that in June, and there will be one more event later in the year in October. So thank you very much. Just also an important plug for the journal for ANZIPPE, Focus on Health Professional Education. If your university or institution is a member of ANZIPPE, then it's a free open access journal. It's got a good impact factor, and it's actually very interesting reading. And no doubt there'll be other people here at today's event who've published in it. So it makes it really worthwhile to read this. So thank you very much, everyone. I think someone's had IT at the institution blocking their link to the survey, but you'll be emailed one to your registration address afterwards. So enjoy the rest of your day, and thank you for joining us.